Below is a much more detailed, expanded, and comprehensive explanation of the Semen Culture Test, covering all 15 points in deep clinical detail. Semen Culture Test, full detailed explanation. Number 1, introduction. A semen culture is a specialized microbiological test used to detect and identify infectious organisms present in the semen. Semen is produced by the testes, prostate gland, and seminal vesicles, and infections in any of these structures can lead to contaminated semen. These infections can affect fertility, sexual health, and urinary function. Male reproductive tract infections are often silent, meaning many men do not exhibit obvious symptoms. Therefore, semen culture is very important in diagnosing hidden infections that may impair fertility or cause chronic pelvic discomfort. Number 2, definition. A semen culture is a diagnostic laboratory procedure in which a semen sample is inoculated onto growth media under controlled conditions to identify pathogenic bacteria, fungi, yeast, occasionally parasites. The test also includes antimicrobial susceptibility testing, commonly called an antibiogram, to determine which antibiotics are effective against the detected organism. This helps the clinician select the most targeted and effective therapy. Number 3, indications. When is the test recommended? Doctors order a semen culture in the following situations. A. Reproductive symptoms, infertility, primary or secondary, low sperm count, oligospermia, absence of sperm mobility, asthenospermia, poor sperm morphology, teratospermia, previous recurrent miscarriages in partner, possible infection contribution. B. Genital or pelvic symptoms, pain in testicles, orchialgia, pain in scrotum, scrotal discomfort, lower abdominal or pelvic pain, painful ejaculation, dysorgasmia, blood in semen, hematospermia, foul smell in semen. C. Signs of infection, urethral discharge, burning or pain during urination, dysuria, frequent urination, frequency, itching around genitals, swelling of epididymis or testicle. D. Suspected medical conditions, chronic prostatitis, epididymitis, urethritis, seminal vesiculitis. E. Sexually transmitted infections, STIs, consideration. Some infections such as chlamydia, gonorrhea, or mycoplasma require PCR, but semen culture may detect secondary bacterial involvement. Number 4, used for, purpose of the test. A semen culture is used to 1. Identify infections, bacteria like E. coli, Staphylococcus aureus, Enterococcus, Pseudomonas, etc., fungi like Candida albicans. 2. Guide treatment, determine which antibiotic or antifungal will work, antibiotic sensitivity test. 3. Prevent infertility. Chronic infections can damage sperm-producing cells. 4. Evaluate sexual health, helps diagnose underlying infection-related causes of painful ejaculation or hematospermia. 5. Monitor treatment. Post-treatment culture ensures infection is fully cleared. Number 5. Why do need of this test? The test is necessary because untreated genital infections can reduce sperm concentration, decrease sperm motility, alter sperm shape, cause DNA fragmentation, lead to infertility or subfertility, spread infection to partner, cause chronic pelvic pain, interfere with ART methods, IUI, ICSI, cause formation of anti-sperm antibodies. Even mild infections can disrupt normal reproductive function. Number 6. What happens during the test? Procedure. A. Sample collection. You will be given a sterile container. Semen is collected by masturbation. Avoid losing the first part of the ejaculate because it contains the highest concentration of bacteria and sperm. Sample must be delivered within 30 to 60 minutes. B. Laboratory procedures. 1. Microscopic examination. Presence of pus cells, WBCs. Presence of debris or clumps. Motility reduction due to infection. 2. Culture and isolation. Semen is spread on culture media such as blood agar, McConkey agar, Sabarod dextrose agar for fungi, incubated at controlled temperature, 35 to 37 degrees. Growth observation. Colony growth indicates infection. Identification is performed using biochemical tests, gram staining, automated systems, Vitek, MALDI-TOF. 4. Antibiotic sensitivity testing determines which drugs effectively kill the organism. Number 7. How long for results? Typical time frame. Preliminary result, 24 to 48 hours. Final result with sensitivity, 48 to 72 hours. Fungal cultures, up to 5 to 7 days. Preparation for the test. Before the test, avoid ejaculation for 2 to 5 days. Avoid alcohol for 24 hours. Do not take antibiotics for 7 to 14 days. Maintain good personal hygiene. Urinate and wash penis before collection to reduce contamination. During the test, collect full sample. Ensure only semen enters the container, no saliva, lubricants. Number 9, risks. Semen culture is completely safe and non-invasive. Risks are minimal and mostly related to psychological discomfort during sample collection, wrong results due to improper sample handling. There are no physical risks. Number 10, normal values. Normal result, no pathogenic organisms detected. Minimal normal flora may be present, skin bacteria. Normal supporting findings, low WBC count, 1 million milliliters normal, no pus cells or infectious debris. Interpretation of results. A, negative culture, no infection detected. If symptoms persist, doctor may order PCR for STIs. B, positive culture may detect any of the following organisms: common bacteria, E. coli, Staphylococcus aureus, Enterococcus faecalis, Pseudomonas aeruginosa, Klebsiella pneumoniae, yeast fungi, Candida albicans, rare pathogens, anaerobic bacteria, Mycoplasma ureaplasma, PCR preferred. C. Antibiotic sensitivity. Report shows S equals sensitive, R equals resistant, I equals intermediate. Help select the correct antibiotic to avoid antibiotic failure. Number 12, factors affecting results. Recent antibiotic use, poor hygiene before collection, ejaculation too early, 2 days, or too late, 7 days, sample not transported quickly, lubricants or condoms used, partial or incomplete sample. Number 13, clinical significance. A semen culture can diagnose chronic bacterial prostatitis, epididymal orchitis, urethritis, seminal vesiculitis, infection-induced infertility, inflammatory damage to reproductive organs. Connection to infertility. Infection may cause decreased sperm count, agglutination, clumping of sperm, reduced motility, abnormal morphology, oxidative stress damaging DNA. Treating infection often improves semen quality significantly. Number 14, no more. Relationship with other tests. Semen culture is often combined with semen analysis, urine culture, PSA test, prostate health, PCR for STDs, transrectal ultrasound, TRES for prostate abnormalities. When repeated after treatment to confirm cure. Number 15, conclusion. A semen culture is a vital test for evaluating infections in the male reproductive system. It plays an essential role in diagnosing genital infections, determining appropriate treatment, addressing fertility issues, and improving sexual and reproductive health. It is safe, simple, and extremely informative. Thank you. Have a nice day.